My name's Kaylee Robinson. I work as a Capacity Development Specialist for the Envision project at RTI International, and I'll be facilitating the second webinar in the Envision webinar series on NTDs, completing the WHO Joint Application Package for NTDs. We're very happy to have Dr. Yajima and Mr. Alexei Mikhailov from WHO, as well as Dr. Uzoma Nwankwo of the Federal Ministry of Health, Nigeria, as our speakers today. We hope you find the presentations both informative and useful in your work to control and eliminate NTDs. So for those of you who are new to webinars, some operational guidance is provided in the top right corner of your screen on the GoToWebinar bar. You should be receiving your audio through your computer. If that's not working, you can connect through a landline that's provided here. If you click in the audio box where it says telephone, it'll give you that information. Otherwise, you're welcome to continue using your microphone and speakers from your computer. If you have any technical difficulties, please type your problem into the chat box on the bottom right, and we'll try and help you resolve it. The slides and recording of this webinar will be available on the Envision website, and you'll receive a link to them in an email following the webinar today. If at any time during this webinar you have any questions for any of our presenters, please feel free to type them into the chat box as well, and we'll do our best to address them. If we're unable to get to all of our questions now, we'll be able to respond to email after. We'd also like to ask you to take a couple of minutes to complete a short evaluation at the end of the webinar. Your feedback is really important to us so that we can make sure we're addressing the topics that are useful to you and your daily work. And then finally, if you find this webinar beneficial, please check out our website for news of upcoming webinars, including our next one, which will be titled Safe Drugs and Safe MDA Programs, Managing Adverse Events and SAEs for Neglected Tropical Diseases, and that'll be held on August 13th. This webinar will also be posted to the Envision website, and it'll be promoted through our Envision mailing list. So I want to first give a very brief overview of the Envision project. Envision's a 5-year project funded by the U.S. Agency for International Development, or USAID. We work in partnership with national neglected tropical disease programs for the control and elimination of lymphatic filariasis, onchocerciasis, schistosomiasis, 3 soil-transmitted helminths, and trachoma. Envision is implemented by RTI International in partnership with CBM International, the Carter Center, Fred Hollows Foundation, Helen Keller International, IMA World Health, Light for the World, Sight Savers, and World Vision. Envision is currently working with national NTD programs in 14 countries, with 5 more countries to be added in 2015. For more information, please check out our website at www.ntdenvision.org, or you can follow us on Twitter at RTI Fights NTDs. So what are the objectives of our webinar today, and what do we plan to discuss? Well, first, Aya will be speaking about how to apply for WHO-donated medicines for NTDs targeted by preventive chemotherapy and report the results to WHO using the Joint Application Package. She'll then speak about the importance of submitting a complete Joint Application Package in time to ensure timely arrival of medicines in country and facilitate effective program implementation. At that point, we'll pause for some questions. And then after that, Uzoma will share Nigeria's experience using the tool for integrated planning and costing and the Integrated NTD Database to strengthen data management and reporting and submit the Joint Application Package to WHO. We'll then take time to answer more questions and get your feedback before closing the webinar. And let me give you some background on our presenters today. We're very excited to have all of them with us. So first, Dr. Yajima. She has been working as a technical officer in the Department of Control of Neglected Tropical Diseases in the World Health Organization headquarters in Geneva for the past 6 years. Her major focus has been monitoring national NTD programs against preventive chemotherapy diseases and coordinating development of various tools to facilitate integrated and coordinated planning and monitoring and evaluation of the national programs at global level, including the Joint Application Package and the Tool for Integrated Planning and Costing, or the TPAC. Then Mr. Alexei Mikhailov works as a data manager in the Department of Control of Neglected Tropical Diseases, also at WHO headquarters. He has more than 15 years experience in data management in the area of public health. In the department, he's responsible for collection, analysis, and presentation or visualization of data related to preventive chemotherapy. He was closely involved in the development of several data management tools for NTDs, including the PCT Online Data Bank, the WHO Global Health Observatory for NTDs, the Joint Application Package, and the NTD National Database. Additionally, he's facilitated WHO's training workshop on the development of the Joint Application Package. And we also have Dr. Uzoma Nwankwo, who is a medical officer and health economist with the Nigerian Federal Ministry of Health NTD Control Program. He is the assistant coordinator of Nigeria's M&E team and works alongside national program data managers to implement a variety of NTD M&E tools. Nigeria's M&E team was the first country to utilize the TPAC and the Integrated Database to complete the WHO Joint Application Package. Uzoma currently heads the NTD Zonal Office in South Nigeria, and he's responsible for monitoring and supportive supervision of NTD activities in 6 Nigerian states. He's facilitated several WHO-organized M&E workshops and has provided guidance and support to other countries that require it. Uzoma is currently a member of 2 WHO strategic and technical advisory groups, global expert working groups, on M&E for preventive chemotherapy NTDs and on investment for impact on the economics, financing, and socioeconomic impact of NTD control. So let's go ahead and jump right into our webinar. I'm going to pass the webinar over to Aya.
Hi, everyone. So I'm going to give a brief overview of the joint application package and its review process. Sorry. Okay. Can you see the screen now?
Yes, we can, Aya. Thanks.
Okay, so I'm going to give a brief overview of the joint application package and its review process, and also provide some tips for using those forms. And Alexei is going to be online with me to answer any questions from you. And feel free to type any questions even during the presentation. And we will try our best to respond to your question at the end of the presentation. But if not, because of the technical issues or the limitation of the time, we will respond later in other ways, probably through emails or on the Envision website. So as you might know, the World Health Organization facilitates donation of albendazole for LF and STH, mebendazole for STH, and DEC for LF, and praziquantel for schistosomiasis. The application for donation of those medicines needs to be submitted by the Ministry of Health to WHO using the tool called Joint Application Package. We also coordinate with the Mexican donation program for the donation of the countries of ivermectin for LF and onchocerciasis, where the joint application package submitted by country with application for ivermectin is forwarded to the MDP. The number of preventive chemotherapy or PC medicines donated through WHO to the countries has been continuously increasing year by year, as you can see by line graph in this slide for each medicine. And the total monetary value of those donated medicines are indicated in a blue bar in this graph. So in fact, like for 2015, it amounts to over 40 million US dollar. And we are really thankful for the generosity of the pharmaceutical donors for this. So how many forms does the joint application package include? So joint application package is a tool designed to facilitate integrated planning, implementation, M&E, and reporting of PC intervention. It includes joint request for selected PC medicines, joint reporting form, and PC epidemiological data reporting form. Annual work plan used to be the fourth component of the package till last year, but from this year on, we decided this to be an optional. So this is how these three forms look like. And I'll give more details on each of the form later. This form might not be new to some of you or many of you. And actually now most of the countries are using this joint request for form to request for the medicine, the donation of the medicine through WHO. But we are noticing several challenges. The major one, number one, is that the forms are very often filled incorrectly. And we have to spend quite some time to clean up or even re-enter all the data into the blank form. And number two, the forms are very often submitted too late. And even we have country requesting medicine to be shipped within the months. And as much as everybody wants to wish to accommodate their request, there is a limit. And we cannot guarantee if you submit the form too late. And because of that, we want to emphasize in this presentation, number one, how to fill the forms correctly. And number two, why you need to send the form well in advance of the planned drug distribution date. We actually don't have enough time to give detailed instruction of how to fill the form this time, but various resources like the user guide and video tutorials are available online, and the web link is provided in this webinar's website and also through the email. But also, more importantly, you can always ask for assistance from the WHO country office, regional office, and headquarters, and also from the Envision and other partners. So please don't get scared of these three forms too much. The current process of application of this WHO-donated PC medicine is that the national NTD program submit the joint application package, which consists of these three forms, to WHO through country office to regional office. And each regional office have them officially reviewed by its own independent review body, which is often the Regional Program Review Group, or what we call RPRG. Then, based on their advice, the WHO headquarters place the order to the manufacturer, from which medicines are shipped to the country. And as I mentioned, the application for ivermectin is sent to MGP in parallel. This might sound like a simple process, but in reality, each step takes considerable time. First, once the national program manager submits the form to the country office, then the country office forwards it to the regional office, and regional office usually pre-review the form and often return it to the national program for a clarification or revision. So it can take about 2 weeks before the submitted forms are actually passed to the independent review group. Then the pre-finalized application package is passed to the assigned reviewer for technical review. They might simply approve or may return it with the question again to the WHO and the national program manager before regional office finally approve the version and inform the headquarters to place order. So again, this process can take another 2 weeks. Then once the WHO headquarters place order to each relevant manufacturer, it will take another 6 to 8 months until you receive the medicine in the country. So we can say that it generally takes, we'll say, 6 to 8 months between the first submission of the joint application package by the national program manager to the country, WHO country office, till the arrival of the medicine in the country. We have set 15th of August of each year as the deadline by which this joint application package to request medicine for the following year need to be submitted to WHO at latest. So now you should be submitting the request for medicine to be distributed in next year, 2016, together with the report of the treatment and the surveys that happened in 2014, meaning the last year. The form do not necessarily need to be submitted all together. You can submit whichever form as soon as they are completed. If you have completed the report first, and then you can submit this first, and then you can send the request later. Requests can be accepted all year round, and countries are encouraged not to wait for the deadline for 15 August to ensure more timely delivery of the medicines. Therefore, back planning the timing of submission is very important in order to ensure arrival of medicine in time of the planned treatment. For example, if you are implementing mass treatment in February in each year, then you need to have the medicine arrived in the country at least 2 months before, which is December in the previous year. Then even if our submission deadline is 15th of August, in fact, you need to submit the joint application package at latest by April in the previous year to be safe. And to ensure timely submission of the joint application package, the NTD Strategic and Technical Advisory Group, or NTD STAG, which is the highest advisory body to the WHO on NTDs, had a meeting this May in 2015 and recommended the country to establish internal data submission deadline much before 15th of August at national and also at subnational level. Specifically for village to submit data within 1 week of the mass treatment, and district to submit the data to the national level within 1 month of the mass treatment. This is basically to allow the national program to use the treatment data immediately after the treatment so that they can analyze it and then they can go back, they can identify the area, for example, where the coverage was low so that they can immediately go back and they do a mock-up. And together with this, the STAG also recommended country to monitor drug usage and inventory at national and subnational level, especially considering the amount, a significant amount and the value of the medicine being donated by the different pharmaceutical companies. So the drug remaining in stock and in the pipeline should also be reported in the joint application package. So now let me explain each of the forms briefly, starting with the joint request for selected PC medicine. Countries are invited to express their 2016 national needs for the following medicine: albendazole and DEC or ivermectin for LF, praziquantel for cysto, albendazole or mebendazole for STH, and ivermectin for onchocerciasis. And countries should express their needs, including not only the medicine to be requested to WHO for donation, but also those that are secured from other sources requested to other donors. This is for us to improve coordination among all other donors and partners and ensure that everybody who are in need will have enough medicine. It's important to note that the praziquantel for schistosomiasis and albendazole and mebendazole for STH are currently donated only for school-age children. However, countries that are willing to include other age groups in the target population, for example, adults for schistosomiasis or preschool-age children for STH where 11 onco are not co-endemic, are invited to express the relevant drug needs in the praziquantel and albendazole-mebendazole worksheet of the joint request form. And these requests should be also entered in the summary tab as shown in this screenshot. There is this section to help estimate the global needs so that we can continue to negotiate with the donors, especially in view of potentially increased availability of medicine in the near future. So you can enter here, select the praziquantel, for example, and you can select target age group other than the school-age children, like adults, and how many people you are targeting, how many tablets will be required, and you can specify which partners or donors you are supplying from. And then you can mention the status of the supply, whether it's requested already or it's received, or you haven't requested and you still need require this medicine. So what is good about using this joint request form? By entering the population and endemicity status of each disease in each district, the joint request form will auto-estimate the number of tablets and bottles required in each district and in the country in total. And the joint request also help coordinate between the LF program and STH program to ensure the request of albendazole for LF and STH do not overlap in the areas where both diseases are endemic. Now moving on to the reporting form. The joint reporting form is designed to report on any PC intervention implemented in the previous year using the DEC, albendazole, mebendazole, or praziquantel, and including treatment data, regardless of the source of the medicine, whether the medicine was donated through WHO or from other partners, or whether the country purchased it directly. And the data should be reported by subnational level, which is usually a district. And the good thing of the joint reporting form is that it will auto-calculate the number of people treated and geographical program and national coverage for each specific disease, taking into account the co-endemicity of multiple diseases in a district. And it will actually help identify the areas where unnecessarily multiple treatment using the same medicine has been delivered due to poor coordination across multiple disease programs, for example, between LF and STH program. The treatment data reported to WHO using the joint reporting form is published online on the several platforms such as the WHO PCT Data Bank and Global Health Observatory in terms of the number of people treated, coverage by country and by year. So it's really important that you report to us the data. Otherwise, it might look like your country is not doing anything in this platform. I'm not going into the detail of this platform this time, but I encourage everyone to have a look at it and using the web link provided to all of you later. And finally, the epidemiological data reporting form is designed to report new mapping data or results of surveys such as the LF sentinel surveys, the results of LF transmission assessment surveys, and mobility-related data. For example, the total number of patients for lymphedema and hydrocele, and the number of health facilities providing service for such mobility cases for LF in each district. The data reported in this epidemiological data reporting form will be used to monitor progress of the national program by WHO and also to re-estimate the population requiring preventive chemotherapy. So now I'm coming to the useful tips working with joint application package. I hope most of you have actually used the joint forms already. First of all, we often make improvements in the form based on the feedback provided by countries. Therefore, please ensure to use the latest version of the form that are always on our website. You can actually find different versions accommodating the different disease co-endemicity status. For example, the request form for the country which has only STH, or the country that have all the diseases, and the same for the joint reporting form. And all the forms are available not only in English but also in French and Spanish. And if downloading is difficult because of the speed of the internet, then feel free to ask WHO, either country office, regional office, or headquarters, so that we can send you the latest version by email. And on the same web page, you can also find a user guide and also video tutorial that will help you navigate through the forms, actually form by form and worksheet by worksheet, and even section by section, line by line. This is very important. When you open the file for the first time, you probably see the warning sign saying that macros have been disabled. In order to ensure all the embedded formula in the form are fully functional, please make sure to click this and enable the macros. And you also need to ensure the files are saved in macro enabling format, which usually ends with XLS or XLSM. And we also find the country not using this function, so this is very important. In the intro worksheet, make sure you enter the number of administrative units in the country, or say the number here, the number of rows that you want in the subsequent worksheet to enter the data. and then click this button, Generate New Forms, so that the subsequent worksheet will create the necessary number of lines to enter the data by district. You can actually add extra line in advance just in case. For example, your country might have 10 districts, but then enter here 15 instead of 10 to have additional 5 lines from the beginning. Otherwise, if you don't do this, the following subsequent worksheet will look like blank. And this is also very important, but we find many countries not doing this. So when copying the data from other sources, do not directly just copy and paste it, but because it will destroy the structure of the form and embedded formula. So what you do is you highlight the cells to which you wish to copy the data from other sources, then right-click and click Paste Special, and then select Paste Values. In this way, it will copy and paste only the values while maintaining the structure of the form. Then, of course, please fill all the fields that require entry. In particular, the endemicity status should ideally match with the number of plant treatment rounds as recommended by WHO. For example, in this Province 2, District 3, it said the endemicity status of STH is 3, which means the prevalence is above 50%. So in such area, the WHO recommends twice a year deworming of treatment. However, when you come to here, the number of treatment rounds planned for the year, this country enter 1 instead of 2. And maybe it's because of the lack of the funds, or maybe because of that is the different national policy. Whatever the reason, we would like to invite the country to explain, provide explanation in the additional information section, either in the shipment worksheet in joint request form or in the summary worksheet in the joint reporting form. And please do not forget to enter the planned MDA campaign dates and dates that medicine are expected to arrive in a ministry's warehouse. And also don't forget to give the full address and contact of the consignee and also the contact person. When all the worksheets are completed with all the necessary information, go to the summary worksheet and generate report. In joint request form, select the type of medicine and targeted diseases. Then click this button, Generate Report. By doing so, it will pull all the necessary relevant information from the previous worksheets, and it will auto-calculate the number of tablets that are required for each disease and how many should be requested, and with this amount of tablets, how many people are supposed to be treated for each diseases. And joint reporting form will be the same. You just basically click this generate report form so that it will automatically estimate the number of people that was treated for each disease and also the coverage, the national coverage and geographical coverage. And put your name and e-signature before submitting. Without this, we cannot consider it as an official submission from the government. Or alternatively, you can also submit the scanned version of the signed summary worksheet together with the actual Excel form, the Excel file. So you might notice that to complete the joint application package, you have to do annual work planning and forecast the drug need, and then make a drug request, including treatment planning, and then you ensure that the drug is supplied, enough supply of drug is secured in the country. Then once you receive the medicine, then you will distribute, and then you do the related work such as surveys and monitoring evaluation activities. Then once all the activities are done, you will compile the treatment data and then submit the the treatment report. So in fact, completing the joint application package actually help not only to manage flow of the medicines, but in fact, it will help to plan and manage the entire PC program. So please use this as a planning tool rather than just a request and a reporting form. And finally, just to mention that WHO, in collaboration with RTI and other partners, developed a tool for integrated planning and costing, or TPAC, and the Integrated NTD Database. I'm not going to give a detail because Uzoma is going to give his experience with this tool in the next session. But just to mention that the TPAC can actually have a function to auto-generate the join request filled with the data that has already been entered in the TPAC. And similarly, the Integrated NTD Database can auto-generate the joint reporting form and epidemiological data reporting form in the same way. So thank you very much for the listening, and that's all from me. And as I mentioned earlier, various resources such as the user guide and video tutorials are available online, and we are always happy to help you. So, and we are also trying our best to address your request, and also by adding training workshop at regional and national level. So please do not hesitate to communicate with us whenever you need support. Thank you.
Great. Thank you so much, Aya, for such an informative presentation and for sharing your guidance on submitting the joint application package. We really appreciate it. For everyone on the line, we're really grateful to have Aya and Alexei's expertise on hand, and they're available for you and are happy to take your questions. So please take a minute to share any questions that you have for them. Type them into the questions box on the bottom right of your screen. You can send them to everyone. You can send them privately if you'd like to Alexei or Aya. So please take a minute to share any questions that you might have on the process. And also, feel free to share any challenges that you faced in completing forms on time and what you've done to overcome that, or what you would suggest for others to overcome those challenges. Please just take a second to type that in, and we will kind of look through the questions, and after our next presentation from Uzoma, we'll go through, and with the time that we have, we'll answer the questions we're able to answer. And as Aya said, we'll follow up with an email and post online any responses we have to questions we're not able to get to. So feel free to share them. Okay, so while we're finalizing that, we'll turn to Uzoma Nwankwo, who will be sharing Nigeria's experience using the TPAC and the Integrated NTD Database to submit the joint application package to WHO. Thank you for being with us today, Uzoma, and I've passed the webinar over to you.
Hello, everybody. Good day. I hope everybody can hear me.
We can. Thank you.
Right. My name is Uzoma Nwankwo. I'm speaking from Nigeria, and today I'm happy to share our experience working with colleagues here in Nigeria to use the WHO Joint Application Package for NTDs to submit requests for drugs and to send in reports of treatments administered the year before. I'm going to generally be giving us a broad overview of the burden of NTDs in Nigeria and, by extension, the volume of national drug need. I will share with you timelines for completion of the Joint Application Package, the experience we've had completing it. I'll also do a quick overview of what the TPAC and the Integrated Database is, what the database is. And then I will run us through the process of implementing it, our experience with it, and share with you benefits we think the national program has benefited, has got using the TPAC and the database. So, Nigeria is a big country. It's endemic for all of the 5 NTDs targeted for elimination. On my screen, you would have a sensing of the number of local government areas, districts, we call them local government areas. Districts are endemic for each of the NTDs, and 2016 target populations. And then you would also get a sensing from the bar chart on the proportion of people who are targeted for each of the NTDs. These figures are in millions, and just so you put it in perspective, the total UK population is about 64 million, and so we basically have to plan treatments for populations that exceed everybody living in the United Kingdom for some of the NTDs. This is a slide from the Federal Ministry of Health. It puts Nigeria's burden in perspective in global context. And you see that we rank very high in almost all of the NTDs. that comes with a lot of responsibility to be able to correctly estimate drug needs and report its utilization. This is like a picture of a geographical spread of just taking one of the NTDs, the lymphatic filariasis, as an example. You would see the deep shaded blue geographical spaces. Those are places where PC NTDs are currently going on. The light, very light green spaces are places where the LF is endemic, but PC is planned to commence in some scale-up process. I also have to draw your attention to the purple area in the center of the country, Plateau and Nasarawa states, where through perseverance and concerted efforts from the country, we've been able to achieve interruption of lymphatic filariasis in those states. So it's not all gloomy. We know we can do it. We just need to expand the purple patch to the rest of the country. Well, requesting PC medicines basically is a process. It's a process that happens in iterations for us. We first need to retrieve treatment reports from the year prior to the year before. We have to also take drug stock inventory. We access the WHO the forms within the joint application package. We fill them out and we submit them back to the WHO. As Aya had alluded to you, it isn't quite that simple. It takes a lot of time, and this depends on the country in question. And if you're in Nigeria, then you have a lot of work to do, or if my colleagues in Ethiopia would also know that. This is from experience what some of the timelines look like. Sorry, the slide is a little crowded, forgive me. But just quickly mention that it's important to begin any of the process early. The timeline WHO has set is August. Here in Nigeria, we're trying to see if we can even do it a little earlier than August. And so we aim to ensure that all of the data from the year before, say 2014 treatment data, that are all received by January, and we commence 2015 MDA plans. When we've received the information, we want to complete the treatment reports, compile them and put them into the database. By May, we hope that drugs for the year before has arrived for the MDA of the current year. More importantly, in the context of this conversation, somewhere in July, we hope to submit the joint application package, that is this month, for 2016, next year's treatment. And we usually do that using the TPAC and the database. Listening to Aya's presentation, it is clear to everybody that if you want your drugs in country a little earlier, you should send your report in, she said, sometime around April. And that's how it goes on. So this cycle happens in iterations. And you have to understand that with the volume of people in need and target population I showed to you, it is very serious business to estimate drug needs. Not just because there are millions of tablets involved, but also because it costs a lot of money, millions of US dollars, even if they're donated from WHO's coordination, but the cost is borne. And so that puts on us responsibilities to be accountable for those medicines and to also monitor progress towards elimination, because it's not just about pushing the drugs to communities. They need to be distributed and effective coverage levels attained so that we can meet our global targets. Now, just to give you a sense again of the quantity of drugs involved, this just summarizes drug requests submitted to WHO. Again, a lot of this information are available in the data banks of the WHO. But these are the requests were sent of the WHO for ivermectin, albendazole, praziquantel, and mebendazole for 2014, 2015, and 2016. And you would see that there is an increase in these requests. That's because new districts are being surveyed and mapped, endemicity levels are being determined, and implementation and treatments are commenced. And so our drug need is increasing annually until we're able to achieve our final goals. So this is a lot of tablets to request, and that underscores again the accountability need. It can be quite difficult to meet reporting obligations. Just pulling out forms from and data from everywhere and try to use them to complete all of these WHO recommended forms that make up the joint application package. Now, I must say that this package is awesome. It's really useful because it's been able to show opportunities for synergy and collaboration between programs, and something that we've leveraged on a lot here in Nigeria to save everybody's time and cost. But typically, to be able to use those forms, to complete them and send in WHO's requests takes a lot of time and personnel. It takes a lot of effort, and from our experience, averagely 4 data managers, 2 M&E supervisors, about 3 program managers, and a lot of man hours that runs into weeks and sometimes months, really, just to be able to get crisp data into the forms. So we're happy and very excited when WHO with its partners was also able to then develop the tool for integrated planning and costing and the Integrated NTD Database, which in themselves, if you can devote the time to implementing and populating them with all of the required data, you are able to generate everything WHO wants you to submit annually with a click of the button. You just need to update your say for instance the growth rate of the current year, select the districts where you now have logistics support to it. And this can be done by one dedicated individual who has all of the information that you would formally require the time of every other person to come and then pass forms from one individual to another, having room therefore for errors and mistakes because multiple people get involved in the process. But this is different. It makes it more interesting. Well, for people who are not very familiar with the TPAC and the Integrated NTD Database, just to say that the tool for integrated planning and costing, the TPAC, is an Excel-based tool. It's very useful for planning. It estimates drug needs for over a 5-year period and also puts a cost to the drugs and the cost of implementation if you enter all of the information you required. For the joint application package, the TPAC is useful in generating the joint request form for select PC medicines and the annual work plan. On the other hand, we have the Integrated NTD Database, which is likely access-based, which is an access-based tool. It for us has become a repository of program data. It stores and analyzes them, and it uses demographic information, disease distribution, surveys, interventions. So clearly, there's some work to do to capture all of this information for every year of your program. And if you do this very well, you'll be able to generate the joint reporting form using the NTD database and the epidemiological reporting form, which are part of the joint application package. And Kaylee had said to everybody that Nigeria has the honor of being the first country that has done this, both using the TPAC and the Integrated NTD Database. And it's exciting to have to do it. These are just snapshots of what I had just talked about. The TPAC gives you those 2 forms, the annual work plan and its request forms, while the Integrated NTD Database generates the reporting form and the epidemiological reporting form. Now, before implementation of these tools, we previously had very vertical and independent programs. And because of the nature of verticality of programs, it was difficult for programs to have opportunities to collaborate and share information. However, with new organizational structure where programs are now housed within a single NTD division, the TPAC, I can say, and remember, the NTD team, was one of those tools that helped that process because it gave everybody the opportunity to sit down together and work on completing a single tool. There were a lot of lessons from that exercise. And today the program is happier for it because after that process, all of the information required to generate request forms annually are stored and housed there for subsequent years. What was the process of this implementation? We had the right people. We had to look for the right people around the table, people who had the information. That would be the program managers, the data managers, people who had costing information, budgets, planning reps. There was introduction of what the TPAC is and what it isn't. Clearly, it is a planning tool, always important to say that. It is not just a budgeting tool, it is for planning, so always good to use. And all parties and all stakeholders had to come to some consensus agreement on what source documents would be, what reference documents would be for all of the information that had to be housed in it. Then we had to populate the several modules in the TPAC, at the end of which there was a debriefing session to show what had been done, what had been achieved, what gaps were left, and a clear strategy to go forward using the TPAC was fashioned out. At the end of that exercise, in August 15th, 2013, Nigeria was able to send in its 2014 drug report using the form generated from that exercise. Why do we still use the TPAC today? We've submitted 2016 will be the third time we're sending in drug requests using the TPAC, because it was just obvious that after the initial meticulous activity of imputing information into the TPAC, all those information were still in the tool, ready for us to update in terms, and the updates we usually do basically would just be to now say, oh, we've mapped new districts, we are now aware of their endemicity status, and therefore we would be implementing in these districts, and then we would select, we'll choose we use some select buttons in the tool to indicate that we intend to implement in those districts, and then it would be populated. And by doing this, we've been able to save weeks, and in fact, I dare say months of staff time previously devoted to this process. And part of the other benefits were that the vertical collaboration was better, where we didn't need to have to request for additional drugs and plan implementation in those places. Knowledge was shared. We are able to consistently submit requests in approved WHO formats because we're able to implement this. And this is the same story for the database. Before we also used the database, we never had like an NTD focused database, and we had different vertical programs, again, all holding they housing their own data, and some instances with data being stored in different formats, which is numerous problems. We also had issues around reporting. Reports from sub-national levels reach the FMOH in different formats, and timelines not really existing. The indicators also were not formed. The Integrated NTD Database was piloted in Nigeria. There was a full training, and its implementation was phased. We had a WHO program managers training led by colleagues from WHO, and these trainings were stepped down to sub-national levels, and there were a series of data entry sessions during which most of our information and data was entered into the database. At the end of all of those entry, program managers had to sit down together, look at the data, and agree, validate them, and then agree that indeed this was true reflection of historic and new data, and that the database was going to be a single repository and authentic source of Nigeria's data. And this essentially is the process. That process, I just have to say that because the database is a living tool, it's a living document template, there is an ongoing passive process of updates as new information comes, but there is a more active quarterly process where data managers sit down together and update the database. And of course, we had to draw information from our archives to hold also in the database, as well as the new information. And just to say that the maps, a couple of the maps I have shown, including the one I am showing now, are maps drawn from information we got from using of the database. So we use the database, all the information we held in the database to generate the maps that you see. The training to be able to do this was given to us by Gahi, this warming world, so we thank them and are grateful to them. What were the benefits of using the integrated NTD database? We now have a single repository of NTD data. It's easy to analyze data and reach and get program trends and take cross-cutting decisions. We're able to submit WHO's joint reporting form so we can get drugs. We can also generate a couple of reports. We select custom indicators and get any report at all we want. We're also able to then establish a clear reporting channel and also standardize sub-national reporting tools because of our experience implementing the NTD database. Again, we've also been able to set timelines. And this process had led to a lot of activities, a lot of buzz in monitoring and evaluation in the state. What's my recommendation to national programs submitting the WHO joint application package? It's always good to begin the process early. It's very useful to do that ahead of August 15 deadline. It's very, very useful to set up national reporting timelines. The forms on the WHO website are usually the most current forms. It's always good to use them. They're not really difficult if you understand how it works. But you should also know that the option exists to use the TPAC and the Integrated NTD Database, and you still have that information to use it for the coming year. And of course, the forms generated from these tools are usually updated as soon as WHO also updates its own joint application package. In conclusion, I would just quickly say that using these tools have had a lot of positive impact on myself and my colleagues in Nigeria, the M&E team. It has saved hours of staff time, which is now freed up for other activities. It's also been able to facilitate submission of the joint application package with WHO, capturing information in an integrated pattern with complete required data, so there is no chance of it not being completed correctly, as I had alluded to, because we're using tools that are carefully programmed to generate the correct forms, and we have done so timely because staff time is now saved. Thank you very much. I very quickly have to acknowledge a lot of partners. Everybody's logo wouldn't be here, but there are a lot of people who have given the program support. The national program, my national coordinator is appreciative. All of us here in Nigeria are happy for the continuous support to the national program. Thank you very much.
Great. Thank you so much, Uzoma. We really appreciate you sharing Nigeria's experience, including the specifics of the process, which I'm sure will be very informative and beneficial to other countries that are considering using the TPAC and the Integrated NTD Database to complete the joint application package. So thank you so much. For all of you on the line, please go ahead and take a second to chat in any questions that you might have for Uzoma about Nigeria's experience and his experience. You can type those into the chat box. So take a second to do that. And let's go back to some of the questions that were shared for Aya and Alexei on completing the joint application package. One that came in was, if you know you will be doing 2 MDAs in 1 year, do you request all the drugs at one time?
MDA round means, because if you're talking about 2 rounds of preventive chemotherapy targeting all the diseases, then of course the application should be submitted at once, and all the information should be provided in one joint request for selected medicine. This form allows to request the drug for 1 round of MDA for LF, 2 rounds of MDA for onco, 2 rounds of MDA for STH, and 1 round of MDA for schistosomiasis.
Okay, great. Thank you. And then another question that we had was, if a country can submit the joint application package at any time during the year, why is the deadline set on August 15th? And I'll go ahead and read off one additional question too, which is, what is the average time that the joint application package is received, reviewed, and a decision taken and shared back to the country?
Yeah, so this one I can answer. So for the first one, so regarding the deadline, we had several discussions within WHO, but also with the pharmaceutical companies. So at that time, so considering that the first possible, at the earliest, the distribution is January in the following year, then if it's like 6 months before, basically the half a year before, we were thinking that it should be enough to, at least if they submit by August, they should have enough, they should have a medicine by, at least by December or January. But then that was the reason that we somehow selected this mid-year. But then later on, we had several.
Sorry, Dr. Aya, we can't hear you. I think your line might have just dropped. So if you can, yeah, just go ahead and repeat the answer, please.
Okay, so there was a lot of discussion between the manufacturers and the WHO about the setting the deadline, and so initially we thought the mid-year should be enough, should give enough time to, at least for the the earliest mass treatment in the following year should be the January. So if these countries submitted 6 months before in August, then they should have enough time to receive the medicine. But then later on, we have finding some experience where many countries request medicine in the same month, like 15 or 20 countries request medicine for the same month, and then the company often are not able to accommodate for manufacturing to satisfy all the countries' requests, and then many orders have to be pending in the queue, and then that considerable delay happens. So that's why now we are changing from the, we are not really changing, but we are, even though we are keeping this August deadline, we are slowly more moving into recommending the countries to consider 6 to 8 months as a lead time. So that's the question, the answer for the first one. And sorry, what was the second question?
What's the average time that the joint application package was received, reviewed, and a decision shared back to the country?
So as I mentioned in my presentation, it's usually 2 weeks, 2 weeks for the review, pre-review by the regional office, and another 2 weeks by the independent review group. So I would say 2 to 4 weeks.
Okay, great. Thank you, Aya. And thank you, Alexei and Uzoma as well. So that puts us at about the end of the time we have today, unfortunately. But as we said, there's some additional questions, and we'll follow up by email and sending the answers out to everyone. We want to thank you all for joining today and sharing your questions and experience. And a big thanks to Aya, Alexei, and Uzoma for all your work in preparing the presentations and for sharing your expertise with us. I just want to remind everyone that the slides and a recording of the webinar, as well as useful links to the joint application package, to tutorials, video tutorials on using that in multiple languages, and other resources are all available, and we'll be sending out an email with all of that as well. And we'd like you to just take a few minutes, if you have that right now, to fill out a very brief 10-question evaluation of our webinar so we know how we're doing and can get your feedback. So with that, we'll go ahead and close the session. And thanks again so much for joining, and stay tuned for more NTD technical webinars from Envision. Thanks again.